So, a warm good evening. So, today I'm here to present my topic effect of metosartan on the reproductive system, especially male reproductive system, and infertility caused due to that particular drug. So, coming over to the introduction. So, normally we will prescribe this metosartan as an antihypertensive drug. So to treat the BP in most of the humans. But when you go for this intake of this drug can lead to infertility in the males due to induction of apoptosis in the reproductive organs like testes, and it also causes a decrease in sperm count and finally leading to aspermia also. That is, total sperm production will be stopped. So this may result in low success rate in IVF also, or any assisted reproductive technology. So when going to the histology affected by this drug, so it can induce even testicular cancers also in vitro condition. But in vivo, it is not affecting histology, but it will cause sterility in the patients who was prescribed with this drug. And the positive results of this apoptosis induction was can be confirmed by flow cytometry results and also sperm counting using microscopy. So when you go for this in vitro studies, these are the four pictures taken from the testes. So in that first picture uh, is the histology of the testes, uh, which is treated with the drug metosartan. And when you go for this treatment, so it was the testis was treated with metosartan in phosphate buffer saline for 12 days in the deep freezer, and after 12 days it was um, undergone processing for the slide preparation, and after slide preparation we can picturize the result after 2 days. So when you see the total histology compared to control one, which is figure 2, so you can see the difference where you can see the sperms and almost all tissue is uh, eliminated. So when you go for a third treatment, it is somewhat better when you include this RNase treatment with the metosartan. Why? Because RNase uh, will act as a holder, or it will capture the metosartan as a enzyme substrate reaction. It will capture and hold on the metosartan, so the damaged tissue can be recovered, or even it induces less damage to the tissue. So when you go for this histology of testes treated with drug and metosartan, you can clearly see the control almost it is similar with the control compared to treatment with only RNAs and metosartan, which is figure 3 and figure 1. So this is the in vivo treatment where male rats are treated with the drug metosartan in vivo condition for 30 days. And after that, we picturize the result after going for histology sectioning. So you can see the first A is the control, where we injected the rat distilled water, and second is metosartan, and third one is RNase and metosartan, and fourth one is RNase and aspirin. So here aspirin is taken as a positive control, where it induces apoptosis conformly. So you can see the B picture and D figure similar in histology appearance, where metosartan similarly induces apoptosis like that of the aspirin. But aspirin is a powerful inductor of apoptosis compared to that of the metosartan. And you can see the control figure with that of the RNase plus metosartan, that is A and C. You can see the similar histology with the control compared to treatment of the drug only with the metosartan. So when you go for the body weight at day 0 and after treatment with the different aids, so when you go for this testis weight and as well as epidermis, so after 30 days of the treatment, so control it is around compared to control the weight increased in RNase plus metosartan group, where we can see the recovery of the sperm production in the RNase A plus metosartan treated group compared to drug treated and that is a drug metosartan treated or aspirin treated. And epidermis weight is almost similar in the case of aspirin, where it doesn't affect the sperm count. So when you go for a sperm count in control and as well as the treated groups, you can see compared to control in RNase A plus metosartan treated group, the sperm count is increased. Similar and sorry, yeah, it is increased compared to control and in both epidermis as well as the testis. Okay, it increase the production and also it will helps in movement of the sperms into the epidermis for the storage. And through this research, we have studied one of the RNAs, A homolog is present in epidermis also, and helps in movement of the movement of the sperms from the testis to the epidermis. And next, these are the flow cytometry results where A is the control and B is the test is treated with the metosartan and C is the RNase plus metosartan and D is the RNase plus aspirin. So there are 4 blocks. So in the control, you can see there is a more population in the S phase, that is maybe doubling. And you can see in the metosartan treated group, at the edge, there will be fluorescence, which indicates apoptosis. And if you see the test is treated with RNase A and metosartan, there is a equal segregation of the that means cells in the cell cycle portion, where you can see the G1 phase, middle dropped U shape is the SRG S phase, and second peak is in the M phase, that is mitotic phase. And you can see the aspirin also similar result with that of the metosartan treated D, where it indicates apoptosis. So this is the testis. In testis, we have performed this study. And when you go for sperm count, A1 is the control, B1 is the metosartan treated, C1 is the aspirin and RNase A, and fourth one is the metosartan and RNase A. You can see how the aspirin is such a strong inducer of apoptosis through the section, that means through the distribution of the cells before R2. So similarly, metosartan also there will be more amount of distribution. So C is the rats with treated with aspirin, where it is a strong indicator. And if you see the D figure, which is treated with RNase and metosartan, the apoptotic cell count is reduced compared to B and C. And this is the Q banding, which is normally did to know whether there is any chromosomal aberrations or not. So first one is the control, where you can see the interlinked chromatin, and B metosartan if you go for it will compared to A, the chromatin organization is low, which will indicating that apoptosis, which indicates that chromosome DNA is fragmenting. And C, if you go for RNase plus metosartan, where you can see the nucleosome disposal, which indicates cell division or gene expression. And last one is treated with RNase and aspirin, where you can see the total fragmentation and formation of apoptotic bodies similar to that of the metosartan, but more compared to metosartan. So from this study, we can conclude that metosartan plus RNA group will act as a positive, and that means treatment of this RNase A along with the metosartan can improve the patient survival and also supports the sperm count. And also in cell cycle analysis, histopathology, and Q banding also supports the use of RNase A along with the metosartan to reduce the side effects. And sperm count restoration also was observed in the case of RNase A plus metosartan in the long-term usage in the normal rats. So, this drug can also prescribed for cancer cells in order to induce apoptosis, so that it can be used for treating the cancers also. Finally, by this study, we can conclude that we can use RNase A to restore the reproductive potential in hypertensive subjects. And next study, we are going for up to now, we didn't induced hypertension in the patients. But next, in this study, we will compare both how the drug affects normal patients and also hypertensive patients. So first, in the figure, this study was did in vitro condition. So A and B are the control, where you can see the short-term changes. That means treated with metosartan for a few days, that is 1 day or 2 days. But B long-term changes, which indicates after 30 days. So we will keep a group of animals and we will test at the second day and after the 30 days. So you can see the changes, and C and D, those are the metosartan treated group. So compared to control, metosartan treated group, if you go for long-term changes, if you observe, so the red arrow indicates synapses of the X chromosome. So in females, this drug don't affect much because it indicates normal segregation of the X chromosome. But Y chromosome containing males will be affected more. And E and F for the treated with the RNase and metosartan groups. When you go for numbering, 1 indicates aggregative sperms and 2 indicates the acrosome reactor sperm. And in the F, it is the long-term changes observed with the RNase A plus metosartan, where 2 indicates abnormal sperm and 1 indicates lupus sperm. And G and H, 1 indicates in the H, 1 indicates interlinked sperms in the case of long-term changes treated with the RNase A alone. So when you go for these are the sperm samples tested, treated with this metosartan and RNA. And next one is testis tissue. And if you go for short-term and long-term changes in the control group, you can clearly see the chromosome markings in the B figure. So it won't affect the so distilled water treated group, it is good. And C and D, if you go for metosartan long-term changes, so there is uh, this chromosomal segregation is disturbed. And when you go for E and F, it is RNAs treated group, where you can see the chromosomal disturbance if treated alone. So GNH or drug plus RNase A treated group, where you can see H, you can see the recovery of the chromatin organization when used with metosartan. So these are the in vivo effects of a drug treated with metosartan and RNase A. And here it is RNase A in short-term and long-term changes. So first two slides, what I have discussed, these are the in vitro studies, but this is the in vivo study. So first two slides in vitro study, I have did with the uh, testis subjecting to incubation with the metosartan. But 3 and 4, I have did with the in vivo administration of the drug through the oral gavage. So you can see similar results with that of the short-term changes. Um, it won't affect much in vivo condition, but in the normal patients. But B, if you go for hypertensive patients, if you give this metosartan, there is a chromosomal disturbance occurring. So you can see C and D is the drug treated rats with 100 micrograms, and sorry, C is with 100 μg, D is with 1.25 μg, sorry, mg, and E is RNase A plus metosartan treated sample at 100 μg, and F is 500 μg given sample, and G you can see the 1 mg metosartan. So by all this we can conclude that if 1 mg is effective, that is effective to give to the 1 mg of metosartan is effective over hypertension patients. So when you give at low dosages like 100 mg or 500 mg also, it will affect the chromosomal organization in both testis and sperms. And if you increase the dosage more than 1 mg also, it will indicate the damage, which can be clearly seen in the figure D, where you can see the 1.25 mg treated rats. And in hypertension patients, G you can observe, where 1 mg treated rats is getting similar chromosomal organization like that of the control hypertensive patients in the figure B. Sorry. So next one is sperms. So you can clearly see A is the control, where you can see the sperm, and B is the hypertension induced control, and C is the metosartan treated with 500 μg, and D is the sperms treated with metosartan 1 mg per ml. So you can see the difference where sperm breakage is there, putting in the C where I have put a red mark. There you can see white color. So normally human sperms, rat sperms won't be like that. It will be like hooked head, but it is acrosome is reacted when you treat it with the metosartan at 500 μg, and you can go for D, which is metosartan treated at 1 mg. So compared to 500 μg or 1.25 μg, 1 mg there is less reactivity of the acrosome of the sperm compared to that of the 1.25 mg, where you can clearly see no sperms at all. And you can study this DNA fragmentation by using Pumet assay. You can see the 500 μg treated sample where you can clearly see the Pumets. And B, it is 1 mg per 1 ml. And F, you can see the 1 mg per 1 ml of metosartan in the case of uh, testis, and whereas B, it is sperms. So from all the figures, you can see the Pumets. So H, it is the Pumet assay of the control testis. And you can clearly see the C where third figure where you can see the more number of Pumets compared to that of the B and F. B and F, you can see at 1 mg concentration of metosartan, where you can see the less number of Pumets in both testis and as well as the sperm sample, which indicates low level of DNA fragmentation. So this is the agarose gel electrophoresis, where you can see 500 μg subjected sample at first sample, second 1 mg, and third 1.25 mg, where you can see the concentrated intensity indicating that some amount of DNA is concentrated there. Remaining two areas, it is fragmented. That's why the fluorescence is also scattered. And if you go for sperm count, you can clearly see here in metosartan treated group, the number of viable sperms is reducing. But in the case of metosartan plus RNA-CA treated group, there is no viability lost in the case of RNA-CA plus metosartan treated group. And also in hypertensive patients, if you go for at 500 μg and 1.25 μg, the sperm count is affecting. But in the case of at 1 mg, the sperm counts are increasing compared to low dosage and high dosage. So how can we induce hypertension in rats? Means you can inject glucose to the rat samples continuously for 5 days, and this is the glucose levels measured in the rats at the 5th day of the after injection. With that too, you have to use high amounts of glucose, that is about 400 to 450 mg per dl. So by conclusion, we can say that metosartan doesn't affect the chromosomal organization at 1 mg per ml compared to low dosage or high dosage than 1 mg. And it majorly affects the sperm count, but not the maturation of the sperm or segregation of the DNA during the cell division. And also it induces apoptotic body formation and also severe looping reaction of the acrosomes. And also in normal rats also it can induce DNA fragmentation, and treatment of the metosartan along with RNA can increase the sperm viability and also it can restore the damaged tissue back by inhibiting the apoptosis also. So, uh, so this is the study we carried out in our lab. So, metosartan can be used for treatment of the hypertension, but at low dose, but at 1 mg per 1 ml dosage, but not less than 1 mg or greater than 1 mg. Thank you.